Hello and welcome to our presentation entitled Adapting to an Unparalleled Outbreak, Experiences of Humanitarians Involved in Design and Delivery of Hygiene Programs. This presentation will be done by Collin from the London School of Hygiene and Tropical Medicine, as well as Perel-Slater from the Emory University. This research was undertaken with support from the COVID-19 Hygiene Hub, which is a service to help actors in low and middle income countries rapidly share, design, and adapt evidence-based hygiene interventions to combat the coronavirus. The Hygiene Hub has three main areas of work. These are translating evidence into practical resources for use in low and middle income settings, and synthesizing learning from response organizations into learning briefs. Secondly, the Hub offers the ability to connect with technical advisors in real time or through in-depth collaborations. Lastly, the Hub is a space to share ongoing work through case studies or our interactive map. The COVID-19 Hygiene Hub is housed at the London School of Hygiene and Tropical Medicine and developed in partnership with the Center for Affordable Water and Sanitation Technology and WashM. We encourage you to reach out to us via our website or by following us on social media. We would like to thank the UK Department of International Development and the Bill and Melinda Gates Foundation for funding this project. Previous studies have described how humanitarian organizations design and implement hygiene programs during crises and outbreaks. But most of these studies are relatively content specific and were conducted after the crisis had ended, which potentially biased implementers' description of situations and of their own work. The COVID-19 pandemic is a global ongoing crisis during which the promotion of hygiene behaviors, especially hand washing with soap, was identified early on as a key prevention strategy. This study's aim and objectives are to understand in real time how hygiene programs are being designed and implemented in low and middle income countries during the COVID-19 pandemic. Further, to understand how program decision-making, action, and implementation of activities changes over the course of the pandemic. To understand the aspects of the COVID-19 programming that worked most effectively and the greatest challenges. To explore how COVID-19 programming may contribute to more sustained changes in hygiene behavior and long-term changes in hygiene promotion programs. Since October 2020, we have conducted 55 in-depth interviews with participants from over 30 countries. We have talked with 25 humanitarians, 16 development professionals, 6 people working for WASH coordination mechanisms, and 8 WASH donors. Data was coded with deductive and inductive codes and thematically analyzed. We have broken our preliminary findings into 5 topics, which are the decision-making process of humanitarians on designing and implementing hygiene promotion activities, how hygiene behaviors were supported by the provision of hardware, implementers' perspectives on monitoring activities and evaluation impacts of COVID-19 prevention programs. Then we will look at the impact of WASH sector coordination mechanisms and donors in supporting the COVID-19 response in different geographic areas. For each of these main topics, we will break down common patterns in what participants and organizations have highlighted as key trends, as well as emerging challenges such as areas that participants felt needed to be strengthened or new solutions need to be found, and lessons learned through insights shared by participants that could help shape future outbreaks. Our first topic is implementing hygiene promotion. Common patterns that we saw were that the majority of organizations were engaged in hygiene promotion activities prior to the pandemic, but it was not their primary programmatic focus. However, hygiene education was identified as the easiest entry point into the fight against COVID-19 for WASH organizations. Many organizations joined government or coordination platform campaigns to reduce duplication of messages and communication efforts. Several organizations adapted these materials to increase inclusiveness of communication campaigns. They did this by translating them into local languages or sign language. In the early stages of the pandemic, messages mostly focused on knowledge building, such as describing symptoms and transmission and appealing to the fear motive. Lockdowns and movement restrictions pushed many implementers to use a more diverse set of communication channels, including traditional billboards and posters, but also TV and radio spots, along with social media and even drones. Emerging challenges that we found were that relying on fear as a change behavior is not sustainable over time, especially in areas where transmission has been low. The fear motive quickly faded. Targeting other motives to increase behavior change is needed. Trying to use hygiene promotion tools during the pandemic was not easy for country offices due to the increased workload that it caused. This was an area of frustration for some technical advisors. Most country offices suggested that piloting and adoption of new tools and work habits should be promoted in non-crisis situations. Lessons that we learned included that the COVID-19 pandemic has led to momentum for the promotion of certain hygiene behaviors, especially hand washing with soap. Future programs should build on this momentum to develop capacity around hygiene promotion in humanitarian settings and give access to dedicated funding. Utilization of communication channels such as social media, phone surveys, and others will allow for continuation of operations and remote hygiene promotion activities to take place, but do not necessarily enable organizations to reach the most vulnerable populations. Inclusiveness of programs should be more proactively thought through at all stages of program design, especially with regard to the use of new technology.
Second key findings are around providing hardware for hygiene behaviors. So most humanitarians mentioned already providing hand washing station in a crisis setting, but the COVID-19 pandemic increased investment in the design and the provision of hand washing station, especially the amount of hand washing station increased and the location changed. Most of them were distributed in public places, especially churches, market, bus station. Distribution of adapted hygiene kits was also a key intervention, and that was mentioned by most of our participants. Maintenance and sustainability of those public hand washing stations was highlighted as an issue, especially the continuous water and soap provision. Difficulties assessing the impact of those stations on COVID-19 reduction and behavior practice was also highlighted. And some participants questioned the value of public station versus household-based station. One of our participants said, "I was always a little bit unsure of the value compared to the amount of effort and funds going into it." Market disruption and material shortage due to international travel bans also question the localization of supply chains for hygiene products, and that should be think through in the future responses. In terms of lesson learned, market-based approaches were successfully used by certain organizations. They believe that these were a good solution to address beneficiaries' preferences and meet their needs, while reducing the risk of disrupting local economies that were already negatively impacted by the pandemic. Our next topic is around monitoring activities and evaluating impacts. Most organizations recognize that many activities were overlooked during the pandemic, despite having staff and team in place. Reason for that included difficulty to define appropriate indicators, difficulty measuring behavior, movement restriction, and lockdowns prevented teams to gather feedback in the field, and the use of new communication channels that we don't necessarily know how to monitor or evaluate was also a reason. The tools that were used mostly gather feedback on activities output and measure self-reported behavior instead of observed one. One participant said, "We are at the output level now, don't ask me about impact." In terms of challenges, one could, to start, the tools we have are not practical in the current climate, and we have not had the bandwidth to create new ones. This really highlights the need to develop easy to implement, rapid monitoring and evaluation tools for hygiene behaviors. Humanitarians mentioned that these kind of tools would be used to assess uptake of messages, sustainability of behavior change, and extent of relapse. They believe that relapse was not monitored enough in this response. In terms of lesson learned, where and when normal monitoring systems cannot be used, organizations use simpler tools that were useful for them, like rapid assessment and midpoint evaluation. Using existing data as comparators was also practical. Research institutions were good at supporting impact evaluation and systematically gathering feedback from communities as really been successful as well. Our fourth topic of discussion is around coordinating the response. Here, participants had mixed perception around how coordination happened during the COVID-19 pandemic. At the national and sectoral level, whereas some highlighted increased cooperation, especially with government partners, other organizations mentioned that relationship remained unchanged mostly. At the organization level, it was the same kind of findings, whereas some people believe that the communication was increased, especially between headquarters and in-country offices. Others believe that travel restrictions limited the support that they could provide. In terms of novelties, reliance on local partners for continuity of activities was raised by many organizations, and remote working has been both highlighted as a barrier and facilitators to improve coordination. In terms of emerging challenges, documentation of good practices, but also failures, has been highlighted as something that is needed, and that humanitarians would like to see more coordination on this aspect to shape future responses. More integrated and multi-sectoral responses are also needed, and many participants mentioned that bridging the gap between the development and the humanitarian world is essential in this kind of global pandemic. The limitation of top-down management approaches and reliance on international staff were highlighted by the pandemic. And going forward, participants mentioned they would like to have more discussion and reflection around localization of activities, building a fairer partnership with local partners, and decolonizing global health. In terms of lesson learned, coordination seems to be stronger in countries or regions with pre-existing coordination platform and history of collaboration, and in places where all stakeholders, including local partners and civil society organizations, could join the discussion. That was a really important comment from the participants. Our last topic was around funding the response. In terms of common patterns, early in the pandemic, most funds were actually coming from repurposed budget from other programs, and where there were only few organizations putting together proposals for specific COVID-specific programs. Funding opportunities were very limited, whereas the need was really high. This was improved in the later stages of the pandemic, when the donors became more agile, responding and funding the implementers. In terms of emerging challenges, it seems that the COVID-19 pandemic has not led to a significant increase in funds for the WASH sector. And this led humanitarians to say that more advocacy work at the donor level is needed to increase prioritization and funding commitments of hygiene promotion programs. Someone said, we had hoped that hygiene promotion will be put to the forefront, but that has not been the priority of our donor. In terms of lesson learned, participants mentioned that funds spent quickly, even internal funds, were the one with the biggest impact on the response. That's where the main finding of our primary result across those 5 topics. In the next months, we are doing some more interviews, especially with WASH sector coordinator mechanism and government actors and development actors in the East Africa cluster we are looking at. We're also planning to do some follow-up interviews with a subset of participants with the goal of understanding how program design and implementation has changed over the course of the pandemic. And we hope to be able to share more outputs through learning bricks on the COVID-19 Hygiene Hub and with a peer-reviewed research article. Thank you so much for listening to our presentation. We would especially like to thank all our amazing participants across the world. And thank you again for listening.